Okay, hi everyone, and thank you all for joining. This is a webinar from the Global Observatory of Long-Term Care. Specifically, this is a joint webinar organized by the Workforce Capacity and Capability Interest Group and the Technology and Long-Term Care Interest Group. Alan Comas Herrera is the director of the observatory, but unfortunately couldn't make it today. My name is Naz. I'm the research coordinator at the GOLTC, and we'll be doing a quick introduction of the observatory. So, what is the Global Observatory of Long-Term Care? The GOLTC is a platform for cross-national learning. It's designed to improve and strengthen care systems globally. Our goal is to identify shared key challenges and showcase how different countries and communities are addressing them. This is an open space for anyone interested in long-term care, including policymakers, industry members, advocates, care professionals, and academics to share knowledge and foster collaboration. How does this work? The GOTC thrives on the willingness of its members to share knowledge and experience. We share publications, build country profiles, and host blogs and guides on key topics and methods. At the heart of the GOLTC are our interest groups. These groups organize webinars, share resources, and collaborate on issues that matter most to them. We have a large variety of interest groups that all members are encouraged to join, steer, or consider making their own. And this is a space for learning, connecting, and driving change together. And so to show the variety of our interest groups, we've got quite a few webinars coming up. On the 2nd of June, we have one from Aging in Commons webinar. On the, I believe, 9th of June, we have one from the GOLTC Migration, Mobility, and Care Workers Interest Group in joint combination with the Social Care Reform in England Interest Group. On the 15th of June, again, another from the GOLTC Migration, Mobility, and Care Workers Interest Group. On June 11th, we have one from the Australian Long-Term Care Interest Group, which quite a few of you might be interested in, and I'll share the links later in the chat. And on the 23rd of June, we have one from the Pain and Care Homes Interest Group. And on the 7th of July, we have one from the Quasi-Experimental Methods Interest Group. But this brings us to today, which is the 19th of May, and we have a webinar from the Workforce Capacity and Capability and the Technology and Long-Term Care Interest Group webinar. So I will pass it over and we can kick off the webinar.
Thanks, Naz. Hi, everybody. My name is Beck Bilton. I'm the Research and Program Director for an organisation called ARIA, which is Aged Care Research and Industry Innovation Australia. I'm joined by my colleague today, Dr. Jody Hillen. Jody, it's just not in full screen mode, but we will go ahead. I'll tell you a little bit about ARIA, but as is customary in Australia, we do an acknowledgement of country to acknowledge the First Peoples of Australia. So Jody and I are presenting from Ghana land, which is in Adelaide in South Australia, and Megan Seaman is joining us as well from Adelaide as well. She'll be speaking later, representing the digital CRC. But the Ghana people are the traditional owners and custodians of the ancestral lands for Jody, Megan, and I, and we pay our respects to elders past and present and value their ongoing connection to land and cultural beliefs. So the mission for ARIA is to improve workforce capability. We're a Commonwealth funded, so nationally funded organisation to improve aged care workforce capability through best practice and evidence, and also to help support innovation and technology. The National Aged Care Workforce work plan is something that ARIA have been involved in shaping, and you can see here that it's around a multi-pronged approach around evidence base, around improving workforce culture, encouraging innovation, and boosting education and training and leadership. And those are the spaces that ARIA support in. And as well, then there's more, I guess, functional focus of the National Committee, which is around uplifting pay and conditions, improving workforce planning, and increasing career pathways. I'm not going to spend too long on this because Jodie's going to um, talk more specifically around the data capability building, but I guess that's just one aspect of the space that ARIA work in. We try and create a safe, psychologically safe space for organisations and aged care workers to work and innovate in, I guess, parallel to BAU conditions, sorry, business as usual conditions, recognizing that in most aged care sectors where there's a formal aged care sector, acknowledging that not everybody's country has a formal aged care sector, but in Australia, Jodie's flicking around the slides at the moment, sorry, but
I'm so sorry. I'm trying to make it work. Sorry.
that's all right. But yeah, we're really trying to create I guess, safe space and an ecosystem where knowledge is available, similar to the Global Observatory. We have a data repository, a knowledge repository. We're trying to offer skills and training to build workforce capability. We focus on leadership. We focus on things like data usage, cybersecurity, technology innovation. And then ARIA also fund things like business development. We do consultancy work and we fund grants in Australia to really try and create that learning and adaptive space for technology and innovation and best practice to be shared. So one of those projects is what my colleague Dr. Jodie Hillen has led in the last year now, nearly, Jodie. And very pleased to hand over to Jodie to be able to talk and Jodie, yeah, reshare your slides to see if you can do them in full screen mode.
Just
Technology's
before,
good when it works.
just
I
before,
know.
just before we jump over to Jody, I wanted to also let Jackie from the technology and long-term care
Oh, sure.
team.
Sorry. Apologies,
No
Naz
worries.
and Jackie. Thanks.
Sorry. No, I just wanted to, it's okay. I mean, it was just a few words about the technology and long-term care group. It feels a bit awkward to be interrupting your flow here. I'm sorry. But just to say that we are an interest group that looks at all aspects of how technology is changing care services and, access to care, delivery of care. We've had one very interesting webinar run by Professor Tenzin Wangmo last year about the ethics of care, technology and care. And later this year, we're going to be looking at how the sort of issues around implementing digital care technologies at scale. So that's all I wanted to say, and hope if anyone has anything that they wanted to sort of talk to us about or had any ideas around those issues, please do get in touch. Um, that's it. Over to you again, Beck. I'm sorry.
Thank you so much, everyone, for the opportunity to present today. I'm very excited to have this opportunity and to share our experiences and also our colleagues at ETEL as well. So what I'm going to do today is just share a capsule of what we've done with one of our projects at ARIA. And the title is Empowering Data Literacy and Capability to Drive Quality of Care. So next slide, please. Oh, we don't need that one. Sorry, Beck, sorry, done that one. Done that one, done that one, done that one. Next one, next one. Next one, please. Okay. Oh, sorry, just back. Okay, so the impetus or aspiration for the flagship 2, Empowering Data Literacy and Capability to Drive Quality Care, came out of the sector. So in terms of the projects that ARIA had conducted before the flagship programs, there was a lot of information and feedback from the sector around, well, we have this data, we don't know what to do with it. How should we make best use of it. So they have these significant resources to capture clinical and person-centered data to demonstrate quality of care to their consumers, but also to governing bodies. And what ARIA was hearing at the point of time before the flagship was, we've got all this data, it's underutilized, data sources are fragmented, they're siloed, things aren't connected. So how do we know, data in one place meets data in another place? The workforce is under-resourced. People don't understand how to use the data. Everyone's under pressure. And there are also few resources to support data literacy and data maturity in aged care. Data literacy and data maturity in aged care was identified by the Royal Commission into Aged Care Quality and Safety as important levers to deliver high quality care. So we had a situation in Australia, quick background, where we had a lot of media around poor quality of care in aged care, and that led to a Royal Commission, which was a significant undertaking by our country, significant resources put into it. And one of the things came out of it was, we don't have the information to tell us whether we're delivering good quality of care or bad quality of care. So we need to work and put resources towards this. So the aim of the flagship project was to empower aged care providers with the knowledge and capability to leverage their existing rich data sources to increase quality of care. Next slide, please. So the flagship programs are a little bit different. I won't go into too much how much they're different, but please visit our website and it will show you how they're quite different. It's not a traditional model of grants, where grants would be between a research institution and a provider. Flagship programs are between a provider and the Aged Care Collaborative ARIA. So we support them through the program and provide a lot of resources for them. So we had eight aged care providers providing expression of interest. 6 were from resident aged care and 2 were from support at home. So in Australia, support at home is aged care services that are provided to people still living at home, which is where the majority of our aged care services are trending towards. What's happening, and I'll explain that a little bit later, what's happening in Australia is very acutely unwell palliative care end-of-life people are ending up in residential aged care. But for the rest of the older Australians, they're moving into this support at home package where they can stay at home as long as they possibly can. Most of our providers participating in this flagship were from urban locations. There was a mix of private and non-for-profit, and there was a mix of large and small. So at the beginning in the onboarding, when we were filling out this topic with people, our participants, they were very aware that good data is at the heart of good care, but they weren't sure what to do with their data. Was it valid? How can we use it to best inform what we're doing? And make sure that our residents and our workforce is really supported by this data, because it's just information at the moment. We're not quite sure what we're going to do with it. So we chose a mandatory pressure injury data indicator. In Australia, we have several mandatory indicators for residential aged care only, not for support at home. But we chose the pressure injury data indicator because it actually has a place in both support at home and both the aged care environment. And without going into too much detail, the actual difficulties and challenges with reporting that we thought we could actually unpack within this project. Thank you. Next slide. So the project phases, oh my God, 12 months we had to do this, which was extremely challenging for the ARIA team, but also for our participants. What we did in the first phase, in the onboarding and data discovery, was we conducted a data and digital maturity survey. And that survey was evidence-based through literature and subject matter experts, and also our internal workforce, on the different types of things we should be looking at to assess an organisation's or a site's data and digital maturity in the context of quality of care. So what I'm going to talk today about is that phase. We are now moving to phase 4, where we're actually asking them to do a reflection survey to understand the impact of our program and our support on their data and digital maturity. Thank you. Next slide. Oh, the car's moved along. So we sent and this has all been approved by Human Research Ethics Committee. We developed a survey tool, which we validated internally and with our subject matter experts. We sent it to them in a paper-based format because what we really wanted to do was them to work as a team together, not just one person respond. We wanted them to get everybody in the project team together, different people, different skill sets, and get their opinion on where they sat on different domains. And then once they've decided on their responses, we had a Qualtrics survey developed that they could then put their responses into, and that's what we will use for the analysis going forward. The impact will only be realised in phase 4 when we do the follow-up. But today I'm just presenting on the feedback we got on the phase 1. Thank you. Digital and data immaturity domains. You may, when Etel presents, you may see a lot of commonalities there. The evidence base in this field is quite thin. So not surprisingly, we ended up with very similar evidence bases for what we were doing. So the domains we asked them to comment on, and the questions were around governance, infrastructure and tools, data quality, analytics and reporting, people and culture. Thank you. So the insights. In terms of governance, they reported that governance of quality care is embedded with each site's governance structures and supporting policies and procedures. However, only 50% had a data steward to oversee data management and quality. And about 2/3 referenced electronic systems as central to clinical governance and reporting. So 2/3 have some extent of integration of clinical ops and financial systems. 50% of sites have partial integration with government platforms, and that means they can integrate their data with the mandatory reporting that happens every quarter in Australia. System integration continues to be a significant barrier. And what they reported is to inconsistent data definitions. In Australia, with the mandatory reporting, there is actually a handbook with definitions, even denominators and numerators, but I'm happy to share that with you. It is still very, very unclear. There's a lot of misinterpretation that can happen around those. And that has been explored a lot during this program. We also have difficulties in system access limitations and resource constraints. And what they realised was that poor integration can lead to unnecessary data handling, data errors, and mistrust in the results. So, for example, only certain people within the aged care site can access certain information, and then it's difficult for them to bring different, pull that siloed data together to tell a story. Thank you. So in terms of data quality, most sites were really, this is a really interesting aspect. Coming on board to this project, they were all very confident in their data quality. And they did say, yep, there's a few challenges. However, as we moved through the program of work and the different workshops, this finding initially saying we're very confident in our data quality does not align with what's happened over the project. So over the project, they have realised that they are not as confident in their data quality because we've asked them to go back and do data discovery. We did workshops on data literacy and how to interpret data triangulation to help understand what variables mean in different contexts. I think this is a really important finding. All sites reported they have standardised reporting to fully implement across the organisation. 50% use predictive analysis, 75% communicate data insights to governance. Again, that's another finding. They communicate it to governance, but now through the workshops, and we've had some subject matter experts come in and teach them how to tell a story with data. It's not just numbers, it's a story, and you have to put it in context and the importance of it. They now understand, oh, we have to do this so differently. If we're going to want to make change and help data inform us of the right intervention to do, we really have to learn how to tell a story with data. And very few actually communicate data insights to the families or care recipients, which is a little bit disappointing, but, you know, I think everyone's working in that space and trying to make sure that people are working towards how to communicate that to consumers. Okay, next one. Thank you. People and culture. This is very interesting too. Data literacy training is not offered or only offered to specific staff. So people even in the quality of care roles are often clinicians that have a lot of experience, amazing experience, but then are put into these quality roles and going, what am I meant to do with this data? How am I meant to interpret it? And also, not only is the data siloed, the roles are siloed. So the person responsible for reporting on quality is not talking to the data analyst who's actually looking at the data and the validity of data. And one of the things we did in our program of work was join those people together. So they had a shared understanding of their roles, so they could understand the strengths and limitations of each person's position. Who collects the data? When is it collected? What are the limitations around that? So when the data analyst is looking at the data, they can understand the context of it rather than just reporting a number. However, a lot of people use data in their decision making, and 63% reported they implemented a culture of continuous data quality of care. Again, that finding did not align to what we learned over the project. So what we learned over the project was data is used as a punishment. It's punitive. And I think that's because it's linked to regulation and funding. So we talked a lot about creating a positive data culture in terms of it's there to inform you. It's not there to punish you. It's there to say, what can we do better? Okay, we understand we have limitations, but what can we do better? And that also then means efficiency in terms of if we understand the accuracy of our data and the reliability of our data, then we can make evidence-informed decisions about the right intervention, and we're not going to waste time and money on the wrong intervention. And I think one of the greatest outputs of this project has been creating a safe space for the providers to come and talk about what their data is and their difficulties with it and how they're going to improve it going forward, and that it's not a punitive space for them. Thank you. Okay, so key messaging. The sector recognises the need for improved data digital maturity and is ready to engage, but it must be a supportive environment. It cannot be a punitive environment. Assessing digital and data maturity alongside data discovery, I think, gives a very realistic approach. So what people might report in a survey, when you go back and do the data discovery, and we were very privileged to have the opportunity to work so closely with them, the survey didn't actually always reflect the reality. Data literacy is a core skill set for aged care providers, and education is currently lacking, and I think that's across the board. Poor quality data and incorrect interpretation of results will be wasteful for everybody. And you must provide a safe space for aged care providers to reveal their data concerns. We've built a really amazing community over the last 12 months. They've almost become like friends. We're like a family, and we have these kind of core, mantras. So we're like quality data in, trustworthy results. Data is everyone's business, and it's about understanding your role in the data Are you the data reporter? Are you the capturer? Are you the clinical person? Are you the data analyst? And if you have some understanding of everyone's role across that spectrum, it will improve your data quality. And also in terms of data culture, be curious, not furious. It's not about being punitive. It's about the end game, which is improving care for older people. Thank you.
Thank you so much for your presentation, and then we'll pass it on to Laura and Raquel.
Yes. So thank you very much, everyone, for inviting us to this webinar. Very nice presentation, Jody. So we are here, myself, I'm Sara Canella from ETEL, with my colleague Rachel Calle, and we're doing this presentation together. So just see if you can see my screen. Can you see it in presentation mode?
Yes, perfect.
Yes, perfect. We would like to present the Laurel Digital Maturity Assessment Toolkit that we have developed under the Laurel project. First of all, my name is Sara Canella. I'm Digital Health Facilitator in ETEL, which is a multi-stakeholder organization based in Brussels. We put together many types of stakeholders, from healthcare organizations, implementers, tech providers, patients associations, and so on. And we facilitate the adoption, implementation of digital transformation in the healthcare sector. And we are involved as a partner in this European Horizon Europe funding project, which is called Laurel, where we aim at developing actionable policies and training tools to support integrating long-term care across Europe. And to do that, we are really involving all types of stakeholders, so really listening to their needs from healthcare professionals, but also involving informal carers, patients. And the idea is to identify innovative policies and systems. So we are, through the exploration of their experiences, we are developing recommendations that we will translate in policy actions. And of course, the aim is to respond to challenges that we know that we have to face about integrating long-term care, relating with the growing demand, the economic budget constraints, but also the accessibility, affordability, and quality of integrating long-term care services, and workforce shortages and systemic reforms. Here you can see the partners involved in the Laurel project. The project is coordinated by EDIPAS, and inside the consortium we have very different stakeholders representative. We have the aging ecosystem with Age Platform Europe, informal carers, with Eurocares, but also we have a social network, healthcare professionals representative, and IFIC, and also a technological partner with the Universidad Politécnica de Madrid. Now we are moving on the technical part of what we have developed as a result with the this digital technology assessment tool. And I will leave the floor to my colleague, Rachel Calle, who will present what we have developed.
Okay. Hi, everybody. Glad to see all of you. Good evening and good afternoon, depending on where you are. The digital technology in Laurel, integrated long care, is just one part of it. Laurel concentrates on a lot of other things, but one of the areas in which it focuses is the issue of digital technology, with the understanding that, and I think this is not, everybody agrees with this by definition, that digital solutions can offer significant support in optimizing the delivery of long-term care services and can facilitate more integrated and person-centered approaches. I think the operative word here is can. Not necessarily will, but can. It has the potential. But in order for that to happen, it needs the organizations that are providing long-term care and are striving for integrated long-term care need to be, quote unquote, sufficiently digitally mature to take advantage of the potential that digital solutions can bring and can offer to service transformation. Go on to the next slide. You all know this, so I'm not even going to repeat what's written on the slide, just to say that I had a very interesting discussion with my colleagues last week, and they said, "What, digital maturity? That's really old-fashioned. Why are you still talking about digital maturity? We were talking about digital maturity 10 years ago." So they said, what you need to be talking about is readiness, that is digital readiness, or facilitating the capacity building for digital transformation. So that's basically, and that's really what we were trying to do with this tool, was to create a tool that would facilitate capacity building within long-term care organizations to enable them to really develop integrated services. Next slide. So what we did, this is just to sort of like make this, give you a scenario so that it's more more down to earth. So we took a scenario where we have a general hospital by the name of Ajax that has a large elderly population. And what they decided to do was, and they felt that there was a need in the community for this, was to set up a home care service for patients who need ongoing support at home. And they hired somebody to do this. And what they wanted to do is to provide a hybrid service, not a totally just exclusively digital service, but a combination of both digital and in-person services. And so one of the first things that the Rona needed to do here was to assess the digital maturity of the hospital and to determine what digital tools could help her to provide an integrated care service to these patients. Go on. So what we did was we developed an assessment toolkit, which is going to sound really similar to what Jody presented. And that's because, I mean, this is not rocket science. We're all kind of in the same space here. So what we did was we developed a tool that works at 4 levels. The first level is the organization, the mother organization, shall we say, that basically wants to implement a long-term care service. And you could look at this in a number of ways. I mean, it could be a nursing home, or it could be, as we gave in our example, a hospital that is developing a long-term care service. Or it could be a long-term care organization that delivers just community care. But in any case, the organization, tool number 1 helps the organization look at its digital maturity. And then we look specifically at the long-term care practice or initiative, the services that it is providing or wants to provide, and the technology solutions that it either has or wants to acquire. So that's what this toolkit does. Go on. So for the tool number 1, which is to look at the organizational's digital maturity, what we're looking at, as I said, you're going to see a lot of similarity here to what Jody presented, but we're looking at digital governance and management, IT capability, strategy, people skills and behaviors, which, by the way, is one of the areas that is the most neglected. Interoperability strategy, data analytics, patient-centered care, and of course, cybersecurity in this day and age. So these are the things that the tool number 1 assesses. Go on. So when she looked at what she needed for remote home care, was she needed a bunch of different tools that she was looking at. Vital sign monitors, motion sensors, video conferencing tool, etc. And so what she needed to do is now to be able to assess either the tools that were already available in the organization or other tools that she looked for in the marketplace that she wanted to adopt and integrate into her and adopt within the the program that she was putting up. Go on. So the first thing that she had to do was to look at the organization that she was creating and to do a readiness assessment. To what extent was it ready on a systems level? To what extent were the services ready for any kind of digital implementation? She had to look at the digital solutions, either the ones that she had or the ones that she was interested in acquiring to see what that technology readiness level was of those tools. And ultimately, she wasn't so interested really in the business readiness because that was more on the side of the tech companies that were providing the tools, but she was interested in looking where the tech organizations were as far as their business readiness level. But that was at this particular point, not so much of interest to her. Go on. Okay, so you're all familiar with this. The TRL, Digital Solution Technology Readiness Assessment, has become very popular, very well known. It's used extensively in Europe, and I think that I can't even count how many projects I have that are using this. And actually, when you look at it, you're assessing a technology using this tool, and the idea was to basically do an assessment for each service and each technology solution separately in the assessment process. It really is most helpful when you're looking at a tool that you want to acquire, although it can also be used to look at a tool that you're already using. But you would think that a tool that you were already using is already operating, so it would already be at least at TRL 6 or 7. And that's what we found, by the way, when we applied it. Go on. But what it looks at, focusing on the services and looking at each service individually, such as, for example, remote care, but it could also be fall prevention. It could be any other service that the long-term care service is providing. And by the way, we were very, just to say this, if I hadn't said it before, we were very focused on long-term care in the community, because that's where we perceive that there's the greatest fragmentation and the greatest challenge to integrated care is when you're providing long-term care services to people who are still at home, are living in the community. So we were looking, when we looked at the services, what we wanted to see in terms of assessing how mature the services were from a not only a service provision point of view, but also from their use of digital support technologies, is we wanted to see how well they were doing information sharing, how much they had interoperability, to what extent was everything that the tools accessible and usable by all of its users. Did they have data security and privacy? Were they looking at societal impact on how this impacted what they were providing, the service they were providing, and the digital support for the services? To what extent was it impacting the community in which their constituent or their clients were living, and also to address ethical issues, which everybody always raises. Go on. So that's what the tool number 2, the Digital Initiative Project Assessment, was intended to do. And this basically is the cover page to how you access. It's now online. We worked very closely, Etel, with Polytechnica to create an online tool. And this is what it looks like, and this is how you get into it. So you open this page, and then you can either go to open tool number 1 or tool number 2, and you do one after the other. Go on. So this is just an example, and I think many of you probably have already seen this. But it's important, I think, to look at this because it also kind of mirrors some of the things that Jody was saying. When you look at a system readiness assessment, you really find in the variety in organizations all of these things at one level or another. You find there are still organizations that have no recognition of the need to change, all the way up to organizations that really have implemented technology into their services with broad adoption, and all the stakeholders are involved, and it's really working and it's well supported. And that's like the two extremes, but you see them all as you relate to long-term care services. I see Jody is nodding her head. You find them all. And so the issue is to really then identify where they are on these scales, and to identify the gaps so that you can begin to focus on the strategy in terms of how you overcome them. So go on. So what we've done is, this is some example of some of the people who have already tested it, and we just put it up here just to show you. I think there are a few more already, but we haven't updated this slide. Go on. And we've received feedback in terms of, and that's really important to us right now. And we're at the stage where we really, really, really want feedback, because we want to improve this tool and make it really useful for the organizations. So we have things that they reported what worked well. They identified some issues. For example, that we don't still have an I don't know option, so we have to add that. And so we have a bunch of improvements that, based upon the feedback that we got, that we're already planning to make, but we're waiting to actually get a few more people testing it and get some more feedback before we decide just exactly how we need to change the tool in order to make it better and more focused than it is. Go on, Sarah. So this is an example, and by the way, this is the cool thing about this tool, is that as soon as they finish the questionnaire, they get feedback. And they can see, this is tool number 1, they can see exactly how they scored themselves. Now, this is a self-assessment, and it could be done by not just one person, it could be done by a number of different people within the organization, each of them focusing. For example, you could have the IT people assess IT capability, as opposed to management people assessing governance. But you can see now how you assessed yourself. And we also have kind of a list of comments and recommendations and suggestions based upon how you assessed yourself as to where you might focus your attention in terms of improving. And so go on to the next one. This is the feedback you get on tool number 2. And so basically, you get feedback on every service, every individual service, and you can see exactly how you assessed yourself. And again, we also have a bunch of sort of comments and recommendations and suggestions for where you might want to focus your attention to improve capacity and improve your ability to really continue on this journey for digital transformation. Go on. And so that's what we're the future of what we're building is we want to improve the tool based on user feedback and test it with as many long-term care practices as possible. And I speak to all of you here. We will give you the link. We would be really, really, really happy, and Sarah's probably going to say this again, if you would go in and test the tool and submit it and give us feedback so that we can make this better. We want to get at least as many people testing it as possible so we can compile, analyze the results, and maybe do some benchmarking, and of course revise and improve the tool. And ultimately, we want to make it publicly available for free, so that as many organizations can take advantage of it as possible. I see somebody saying that they also did some other similar stuff. Okay, Sarah, back to you.
Yes, thank you, Rachel. So we will be happy to share in the chat the link of the toolkit, so you can test it if you want, share with the other organizations of integrated long-term care that are interested to participate. With the Laurel project, we have also a community where we are organizing workshops, webinars, activities. We would be very happy if you want to join us. You can find here the QR code. And also we shared the link in the chat after that. So very happy to being here. And if you want to contact us, we would be happy to provide any additional information. Thank you very much.
Thank you so much, Sarah and Raquel. That was a great presentation, and you've got claps all around, which is great. Our next presenter is Megan Snewin. Sorry if I said that wrong.
Hopefully I am sharing slides for you guys. Great pronunciation, Naz, of my last name. It's Snewin, like spewing, but with an N. It's a difficult one. That's the let me see if I can get that in interview for you. Give me 2 seconds, everybody. Hopefully that's
Perfect.
has that come up?
Yeah.
Is that better?
Yeah.
Is that in presenter mode?
Yes, it was.
Great. Awesome.
But
Hello, everybody.
It's gone now.
My name is, oh no, sorry.
Sorry, Megan.
Hopefully we can get this right.
The Australians are do as we say
My-
with digital technology, not do as we do, Megan.
This is perfect.
Yeah.
I know. And good morning, good afternoon to everyone else. And we are about 10:15 here in Adelaide, and I have been lucky enough to be with Beck today, this evening, and Jody at a networking event that ARIA were putting on for innovation. So we are sort of tired. So I apologise in advance. My boss is going to kill me because I could not find my Zoom background, and I can see all the gorgeous ones from Aria and Eshel. And so you've just got me and a blur for the next 10 minutes. So I hope that that's good enough. So by way of introduction, my name is Megan Snewin. I work for the Digital Health Cooperative Research Centre. I'm a senior program manager here and work particularly in aged care strategy. I'm joining you today from Adelaide in South Australia, the best wine country that you probably know of. It's world renowned. And I look forward to telling you more about one of our really important initiatives here. As is customary in Australia, we do an acknowledgement of country. So here at the Digital Health CRC, we acknowledge the traditional owners of the country throughout Australia and their connections to land, sea and communities. We pay our respects to elders past, present, and extend that respect to any Indigenous and Torres Strait Islander peoples meeting here today. Quick one on agenda, and this is just really for me to remind myself what I was talking about tonight. But I will give you an understanding of what the Digital Health CRC is. Talk a little bit about Australia's aged care landscape, one of our research-based projects, and then an initiative that we've got underway called Connexus. The Digital Health CRC and the Cooperative Research Centre program is generally funded out of the Department of Industry and Science here in Australia. They're time limited cooperative research centres. They can be of different topic industries or topics. So we've had one in digital health that also has straddled COVID. That was a really interesting experience. And then there's other CRCs based on government priorities. And so the 7-year funding funds that come from the Commonwealth, the federal government, but they also have industry funding and research, so academic university funding. So we We're $110 million. We've worked with over 60 organisations, 17 universities, and I know we've got some researchers on today, and 17 universities is a lot of universities to work with. So we're very lucky to have worked with so many of them here in Australia, bar a couple. And we've also work with large, tech partners, industry partners, and other subject matter experts, SMEs, small to medium enterprise organisations in Australia in the digital health and technology space. So where our purpose is to advance digital health innovation by linking these organisations together. So academically powered, solving big issues in this space. That straddles a lot of different themes. We have had projects looking at improving access and equity, given our huge landmass here in Australia. We've got some, telehealth in very remote areas. Some projects in that. We've also got other projects which are looking at the efficiency and effectiveness of algorithms and AI, and then, sort of at the other end of the spectrum, linking data sets and developing digital tools and things that will are digital health innovations. So the project I'm here to talk to you about today, though, is related to, long-term care. We started, and similar to ARIA, they reported, around the aged care data landscape in Australia. We started back in 5 years ago with a research-based project funded out of with the government as a partner, Bupa Aged Care, University of Queensland, the Australian eHealth Research Centre, and provider and vendor combination. With the challenge that the lack of data standardization and the lack of minimum data sets and other evidence-based functional assessments is causing a real problem. It's still causing a real problem. This challenge isn't solved yet, but we are working towards it. So this research project was, yes, as I said, 5 years in the making, has concluded now. But what came out of it and what it demonstrated was the critical need for a nationally consistent approach to assessing the needs of older people. Every provider is doing it a different way. Every person that works into an aged care facility, every nurse and clinician is doing it a slightly different way. Every vendor has developed a slightly different way of assessing the needs of an older person, and that is making it really difficult to understand the data, really difficult to collect, but also really difficult to interrogate and compare across different providers, even within different homes. And so it is a real workforce productivity issue as well when you move from different settings, but you're doing the same job, but with different systems and underpinning with different clinical data and functional assessments. It's proving really problematic. So the research project set out to solve that. And we got some of the way there, but as is with everything under a research project, what we build under the research project then needed to be scaled and sustained for something that could be used sector-wide. So post the project, what we did was continue to invest in creating the evidence base. You'll see a couple of QR codes here for you to grab. We looked into what it would take to solve this problem, and to do that, we have picked the Interi long-term care facility assessment and instrument as a de facto standard, and looked into and did a report on what it would take, what the effort would take to implement that across Australia. So part of the problem that we have with all the different vendor and provider combinations is that nobody wants to get rid of their assessments. We understand that there are other assessments in the system that help with operational and other day-to-day activities outside of the clinical and functional assessments. So it's very hard to convince a provider that their software is not the best software and their assessments are not the best software. So how do we come up with a solution where, if we want to get to this point where we're looking at standardized data to make meaningful data, as Jody mentioned, then how do we move everyone away from that? So we've come up, we generated a study which came up with some ideas for that. Coupled with that, we also jointly commissioned a piece of work with the CSIRO, and that looked at just documenting and highlighting all the complexities and fragmentation of the data, the unreliability of the data. And I think Jodie touched on this as well, where she was talking about the fact that providers out of the Royal Commission in Australia, there was a number of recommendations made, and one of those was that they needed to implement quality indicators to be able to look across providers' care and have that reported into the government. And yes, that recommendation has been fulfilled, but not in a way that is helping lift quality. So it's at the moment reporting for reporting's sake. The providers are not confident in their data. There is a lack of understanding about what that data is showing, even from the Commonwealth, the government's perspective, not just from the provider's perspective. And it is taking an inordinate amount of time for providers to collect, which is taking time away from care. So all of these points, the project that I talked about before, Aged Care Data Compare, coupled with these reports and other activities in the Australian aged care sector, all are pointing to the need for the implementation of a standard, a functional assessment in aged care to support interoperability, to support reporting, downstream reporting, and to support the understanding of providers of what their quality is across their different homes. So enter the solution. So yes, we've talked a bit about the problem. And I think also that Raquel and Sarah touched on this, that digital implementation of long-term care facility or digitisation of long-term care facility instruments have the ability to lift care. So how do we get people to move to this without disrupting a sector that's already been disrupted? You may or may not know, in the Australian aged care sector, post the commission that we had, there has been change on change of legislation, but then introduction of other regulatory reporting burden. And so the change fatigue is real. And what we thought when we came up with a solution was this, that we needed to address that change fatigue with not disrupting the whole sector, but also make sure that anything that we did considered that it needed to be embedded in existing workflows, because people aren't going to change their workflow of how they care necessarily just to record something in terms of just having it digitized, and capture once, reuse many times, so that can be used through the continuum of care across different settings into hospital and out of hospital acute care. How do we flow that data across and ensure that there is interoperability between different systems? How do we automatically generate quality indicator downstream reporting based on the intra long-term care facility instrument. And how do we align that all to national standards to make sure that whatever we produce is sustainable in a way that can be used by more than one vendor and provider combination. So we have built Connexus. Connexus is so born out of research and moving into the innovation and now implementation phase. We developed this in the middle of last year and into the end of last year, and now we are looking at trialing this with providers. We've successfully connected to 3 clinical information systems now. So Connexus is a smart on fire quality indicator app. It launches from any clinical information system. So the smart on fire part is the bit that connects into an existing clinical information system and allows the launch of Connexus from that. So it's developed once, sort of deploy many times. It has the inter long-term care facility functional assessment built in. But what it does is brings in and pre-populates that questionnaire with any existing data that is in the clinical information system. So the existing clinical information system. So, software vendor 1, software vendor 2, software vendor 3, they've all got slightly different they've all got different systems, they've all got different data models, but we've mapped that through to the intra long-term care facility assessment and brought that into Connexus represented as FIRE. So that is saving nurses and clinicians time so they don't have to rework re-enter the same information. And as they go through the intra long-term care facility assessment, it is generating the quality indicators that are part of that assessment and a framework, but also that are the National Aged Care Quality Indicator Program. So the ones that the Department of Health here in Australia stipulate that you report on, it's generating those in real time. So the last part of the functionality in Connexus and the downstream reporting that it generates is able to be submitted straight into the Department of Health here via a business to government portal. We can go from the individual level data through to the aggregated data ready for reporting. And then if there is data issues that need to be fixed or triangulation of data, then you can click through down back into the individual level and fix that at an individual assessment level. So you might be thinking to yourself, why does this matter? Well, we've used the long-term care facility assessment as a policy demonstrator to government that that to provide them confidence in the data that can be generated around quality indicators. If we're all using the same thing, it's an apples to apples comparison, as opposed to at the moment, which is a very different scenario. To provide government confidence that there is a technically feasible way of introducing a standard functional assessment in Australia. Hoping that providers can get some time back to optimize care, and focus on what really matters in caring for their residents, empowering consumers with better information. So for consumers, it's not repeating themselves and understanding that information is all coming and being recorded in the same way. and which gives us a basis for internationally standardized, so sharing on an international stage. The international the Interi long-term care facility is the recognised gold standard in assessment, backed with 25 years of evidence. And so to be using that, if it was mandated in this country, would be fantastic. And for us to then be able to do international comparisons with any country that has implemented it would be a great outcome. So for us and why we've developed Connexus, it's really about a plug and play model to be able to implement a mandated functional assessment across the Australian aged care sector. So develop once, deploy many times, globally aligned, but locally proven. So built for the Australian version of the Interi long-term care facility, but then globally aligned with other countries that have implemented Interi. Built for interoperability and impact. So looking towards modern standards to be able to share information across different systems through API and other mechanisms, and then collect once and reuse many times, which we haven't quite got there yet in the Australian aged care landscape. So where are we at the moment? As I mentioned earlier, we are trialing Connexus in different providers. So we've connected into a number of clinical information systems. So the trial's designed to demonstrate a few things. One is the ease in which we can integrate with via the Smart on Fire functionality, and the other is what the value of standardized functional assessment data is in delivering real-time person-level quality indicators to support high quality care. We're inviting anyone to join us on this journey, even just for a demo. If you're interested, we are looking at providers and vendor combinations to participate in the trial. Please reach out for more information. We're looking at extending this into cover what's called community care around the globe, or support at home program here in Australia covering home care. Looking at different opportunities for that. So, yep, just my email address for any information, please reach out. That's it from me.
Thanks so much, Megan, and to all of the speakers tonight. Amazing work from Etel, the CRC, and also the work that Jodie's been doing, and can really see a lot of synergies. As it was pointed out, the evidence base is thin, but it's really, I guess, reassuring to see what everyone's doing in this space, and really privileged that ARIA's in the opportunity space to be able to work with Etel and the digital CRC. Always interested in collaborating and not duplicating. So I think it was Diane asked a question around the different sector settings that Ethel and ARIA's work have been doing, and so just to reassure you, Diane, that Jodie and the Ethel team are working closely together to share findings and information. ARIA's cohort does include a couple of aged care providers who provide either both and are focused on home care, or provide solely home care. So there are some synergies with the community-facing work of Ethel. Rochelle, I had a question just to start off with, and I encourage everybody who wants to ask a question, please put your hand up, or if you don't feel comfortable doing that, put it in the chat. But my question, Rochelle, is the work that you're doing is great, and I love the immediate feedback and also the suggestion functionality of what to focus on or improve upon. That immediacy is amazing. Have you had discussions about whether or not it's valuable and or possible to benchmark for people to benchmark themselves, or do you think that's not I guess a useful application of the data that you're collecting?
I think it is a useful application ultimately, but I mean, we have to get a sufficient critical mass
Number. Yeah.
in order to be able to give valid benchmarking. So that's why
Understand.
I'm so eager for so many people, as many people as possible to
Yeah.
use it, so that
Yeah.
we begin to get sufficient data so that we can begin to see, is there, so people could, and I think that would be valuable for an organization to look at itself against others.
Yeah. And particularly when you get the critical mass of data to be able to potentially scaffold that into, okay, well, I'm a small provider or I'm a this or a that, and then
Well,
be able
yeah.
to compare myself to like organizations rather than, unfairly compare a small organization, to a really large multinational or something.
Right.
And
So
not that they're always doing it well, mind you.
so one of the things that we ask right at the very beginning of the questionnaire is the size of the organization, the number of
Exactly. So
the
yeah,
number
you'll
of
have
people they're
that.
taking care of, so that we can do that kind of
Yeah. No, we at ARIA in Australia would be absolutely happy to do a blurb and promote that out to as many people in our stakeholder networks. And I'm sure if we twist Megan's arm, she'll do the same. So she's pretty malleable at 10:46 p.m. at night. So I'd hit her while she's low and get her agreement on that. Um, Looking at the chat.
Can I just,
Sorry.
Jody wants to say something.
Yes, go, Michelle.
Oh, sorry.
Oh, I just wanted to add to what you said back,
Yeah,
that what I think is a really valuable exercise is the triangulation of data, and we talked about that a lot in flagship 2. So you have a survey response, but then you have to match it with something else, and educating aged care providers on how to do that, in terms of they may pitch their, we're in Australia, we're in quite a punitive regulatory environment. So they will probably overestimate where they are on certain levels. But then to create that environment where they're safe and can actually say other things, I think is a really important way to really deep dive into where they are and where they need to make improvements. So I think that's something as a group we can think about. How do we do that? How do we facilitate it? How do we bridge that gap?
Well, one of the things that's nice about the tool is that it's a self-assessment tool, and they don't have to be identified, so that they basically are doing this for themselves, and they don't have to share their name with anybody.
I think that's great, Michelle. But what we found was they completely overestimated their data maturity. They completely overestimated it in terms of the survey. Because I think that's in the environment here in Australia, and there's so many confounders on it. And then when we went with them individually and did the deep dive and created a safe environment, they revealed to us so many problems and issues. And we don't want to say that because it makes us look bad. We're like, no, it actually doesn't. It makes you look good because you're actually trying to do something about it. So it's that disconnect.
Yeah.
It's that data culture. It's about, I guess what I'm saying is, and I think what Eto has done is is totally amazing and global, and I'm so appreciative of it. But I wonder how true it is reflective of where aged care providers actually are. That's the only question is. And I'd like to work with you on how to validate that, like how to validate the findings of the survey against what the real truth is.
No, that's tricky, but I'm really happy to do that.
Yeah,
That'd be
it's one of
great.
those things that you don't know what you don't know, right, Jody? And that's what we
Exactly.
find is that, yeah.
Yeah,
I mean, you can
exactly.
make the assumption that
Yeah,
what Jody is saying, and that is that people will tend to try to make themselves look better than they are.
yeah,
The only
yeah,
thing is that, you know, they can do this for themselves and they really don't have to tell anybody.
Mm.
So if there's just between me, myself, and I, maybe I could be a little bit more. And I think one of the things that maybe would also be useful, and I think Jody found this in terms of her interaction with people, is if we could say, look, guys, you know, do this for yourself, but if you want us to help you, if you want us to support you and give you some guidance and share some, you know, tricks and
yeah.
links and all of that, we are so happy to do that so that they know that it's not.
Mm.
It's not a blame culture. It's not about blame. It's about
No, it's
understanding.
a normal human reaction, really. It's a
Oh, of course, yeah, of course. I'm not being critical about that. We all experience that in our daily lives, and it's just I can only speak about the Australian context, but I'd love to hear from other people in this group about their context, about what it feels like to try and maneuver yourself in this space, and what regulation are you trying to meet, and then what's the motivation for meeting that, and then what are the unintended consequences for meeting that. And that is such it's the context, isn't it, Rochelle? It's the context of everything we do. And if we don't understand that context, we don't understand what we're reporting.
I think I'd use the analogy, and then we'll move on because there's some questions in the chat. But
Okay.
and this is a very first world analogy, and I acknowledge that. But it's a little bit like when you speak to someone who decides to build their own home themselves, and it's that content that they go, oh yeah, we're going to build our own home, and it's not that hard. And then you talk to them, 6 months, 12 months into it, and they go, oh my God, what I didn't know about home building that I do now. And so I don't think it's just the blame culture or the punitive. I think it's that the naivety of you don't know what you don't know. And so there's that as well. Paul has a question for all presenters. Paul's question is, I guess we all in the presentations tonight have focused on the digital literacy of the organizations, the providers, the workforce. But he's curious, sorry, and I'm struggling on one screen to be able to see it. Do the functional assessments and the measures of digital literacy and comfort also include that for the patients, clients, or end users, and the role of the effectiveness in the digital care intervention? So yeah, his
I
question
think,
is around, the next layer down from the work that
mm,
we've presented.
Well, so if you
So,
look at
yeah,
if you go into the tool, you'll see that in our tool, one of the things we do in terms of helping people evaluate or assess themselves is we ask them questions like, how are your users doing this? Are your users really using the tools that you provided them with? Are they, how many times a day? How long? How many hours of the day? Are they really using it, and what are they using it for? So we're trying to get at the patients and the patient's family to see how if they've implemented digital tools, to what extent are
yeah,
they really getting adopted? Are they really usable? Are they really accessible? And
mm,
the proof of the pudding is in the eating, and that is, are people using it, and are they feeling that they're getting benefit from it?
Yeah,
Yes,
that's
there's no
great.
question that that's crucial.
Yep.
That's crucial. It's not only the professionals, but for example, if you implement some kind of a thing using video conferencing, obviously you have to have both sides using it. Otherwise it doesn't work.
Megan,
And
did
I'll
you
just
want to
add
add?
to that. Yeah. And I was going to say, so we've been focused on clinical data, getting that right across the system. So in terms of what we've done in Connexus, the intra long-term care facility assessment doesn't take into consideration any digital literacy or comfort. But as part of the Australian aged care mandatory quality indicator program, there is a quality of life measure and a consumer experience one, and that is where those two things get measured, not necessarily digital literacy from a consumer's perspective, but certainly the comfort of residents and clients does get measured from those two quality indicators.
Thanks,
And they're done
Megan.
through surveys,
Jody?
aren't they? Megan, they're done
Yeah,
through surveys. And
yeah.
that gets reported, if anyone's interested on the output, it's reported on the Australian Institute in Health and Welfare, so aihw.com.au. You can go in there and it's called Gen Aged, capital G, capital E, capital N, aged. And you can look at all the data there that Australia captures at a national level, very high level, but it is really it's probably one of the best nationwide data sets we have in terms of people's experience of aged care. And that includes also data on who accesses aged care, the types of aged care they access, the cost. It's stratified by rural, remote, and different kinds of other cohorts. So it's a really valuable resource if you're ever interested in seeing the aged care space in Australia, the Australian Institute in Health and Welfare. You can go to that website and there's lots of reports there. And there's also shiny apps where within the report, you can click on different tables and stuff and find out different variables. So it's a very useful resource.
Thanks, Jody. And we can provide that in our forum. Naz, help me, it's 10:45. In the interest forum, we
It's
have
10:57.
sorry, 10:57 now. We have a forum. There's a forum on the Global Observatory website that can provide links and resources, and if that's something that's useful, we can provide that link there or in the Australian cohort website. So happy to provide those resources out to people.
And
Very conscious, we've got 3 minutes, so I'm going to silence Jody.
oh,
Martha, sorry, Jody, that's very rude. Martha has said that she's developed her group, her work, her team has developed a sensitizing framework for measuring digital maturity based on the research that they've undertaken evaluating 8 different tech projects in the UK and also incorporating and synthesizing other digital maturity frameworks, well, that were available. And so that's work that we'll follow with interest. And I think, sorry, thank you, Megan, for putting the Gen Aged Care data there, the link there. And Paul said thank you to all the panelists for their responses to his question around end user insights, engagement. I'm going to call it because I've lost the capacity to speak. Thank you so much to all of our panelists tonight
thank you.
for their very generous sharing of learnings.